illicit drug use in the country is on the rise. We know this, with cocaine consumption spiking 229%, and methamphetamine also climbing 74% in 2024 compared to previous years. How often these drugs are being used? Nearly a third meth users now take it daily or near daily, and regular cocaine use is also increasing. The New Zealand Drug Foundation is sounding the alarm, saying investment in harm reduction, early intervention and support services simply hasn't kept up. They warn that without serious action, our country could be heading towards a full-blown crisis. And that's despite record drug seizures. The black market is blooming, raising big questions about whether our 50-year-old prohibition-style drug laws are fit for purpose. And while the use of hard drugs is surging, substances like cannabis, MDMA and psychedelics remain more common. Many Kiwis are using them for self-medication or therapeutic reasons, and the Foundation argues it's time to stop criminalising users and instead focus on safer legal access, especially where there's growing evidence of medicinal benefit. The Drug Foundation's Policy Director is Dr. Jacek Kolodziej, and he joins me now. Good afternoon, Jacek.
Yeah, thanks for having me.
It's lovely to see you today, and there's a lot to unpack here. So firstly, I'd like to look at the numbers that came out of the Foundation's latest survey. What do you think is driving the massive spike in cocaine and meth use?
Yeah, that's a good question, and you've captured it really well with the recent increases. I think that the recent increases are primarily dictated by the increased global supply of illicit drugs. I think with the approach that that has focused primarily on enforcement and drug busts and the supply side of the drug issues, I think we're really trying to play a whack-a-mole, and New Zealanders are really at the mercy of the illicit drug markets globally. It's like this, hydra that you chop off one head and another to grow back. So I think that there is it's probably a good time to make sure that we do invest substantially more in harm reduction, in finding ways to reduce the harms of drug use, and that would include, for example, increased investment in addiction treatment as well, because these are some of the issues that...
I'd like to get to that shortly, Jacek, but we have had record drug seizures. It seems on a weekly basis, we are seeing it caught at the border. But you mentioned like whack-a-mole. It doesn't seem to make a dent, do you think?
Yeah, it really is a reflection of global trends. The supply has ramped up quite big time. UNODC, this is an agency with the UN that deals with the global drug control, has been warning about the increases in both methamphetamine and cocaine availability, and that drives the supply volumes up substantially. And that also effectively drives the reductions in price and increasing some of the availability as well. And we've seen some of that play out in New Zealand as well.
Yeah. Were you shocked or surprised, at least? Probably not a lot shocks you anymore, but were you at least surprised by the increase also of daily or near daily meth use? That's really concerning.
I think this is where the concern is, because for most substances, there's a whole spectrum of use. So most people who use substances, and that includes some of the Class A drugs like methamphetamine, do use them relatively regularly or occasionally. But we've seen that increase in daily or very frequent use. That is normally a really strong indicator of potential for harm. And we know that daily use is a strong predictor of quite serious adverse health outcomes, and that includes, for example, things like overamping, which is taking just too much stimulants that has very poor health outcomes associated with it, and also post stimulant psychosis, hospital admission, and that just increases the demand in the health system as well, and really speaks volumes to the need of trying to prevent that. And we will see eventually, with the increased frequent use, increase in demand for addiction services as well.
Yeah. Is there a particular group or demographic, Jacek, that the foundation's more worried about when it comes to these rising numbers, or is it across the board?
Look, we don't really see, we don't really have very specific data around the consumption. We do see some prevalence of use in communities that are more likely to experience challenges in accessing the health system, for example, and that are currently underserved by the health system. So we do see that, and quite a strong predictor of substance use that is harmful is actually belonging to groups that don't have access to really good healthcare, and
Yeah, right.
there is some also economic challenges being faced.
The foundation, and you touched on it at the very beginning, that as a country, we've underinvested in addiction services, and it is putting an immense strain on the sector. How urgent is that as we turn it around? And what would it look like? When you say you want to see more services? Is it beds? Is it people that you can go and see? What is it? A range of what?
Yeah, that's a really good question. I think that there's a range of needs, and well, I think there's a need in all of those spaces. I think where quite a lot of underinvestment has been particularly visible is in the area of early intervention, harm reduction, and prevention of harm. So trying to intervene early before serious harm occurs, or trying to look at moments, at times of people's lives where we can actually prevent some of the serious harm from happening in the future. That is a really, really strong point, because prevention is better than cure. So we
Yeah,
really would love to seeing a bit of a turnaround from that system, which really prioritizes that ambulance at the bottom
yeah.
of the cliff instead of focusing on preventing some of the harm.
Are you saying that at the moment the way it works is people just tend to they don't get the help they need earlier on, so they end up the drug addiction gets bigger and stronger and faster, and they start taking more and more?
Yeah, essentially that's something that can happen quite easily right now, because people
Mm,
don't really have the tools that would prevent them to, for example, moderate their use or use substances in a way that is less likely to use to cause some of the most serious health harms.
um,
So definitely you're right.
can we look at cannabis and MDMA and psychedelics, are the
Mm.
most commonly used illicit drugs in New Zealand, but where do they rank when it comes to potential harm? Quite low down, aren't they?
Yeah, that's right. So, for example, psychedelics, and we've seen some increase over the last decade in use of psychedelics, and they are consistently ranked as some of the substances that are associated with the least harm.
Mm,
It's not to say that there aren't any harms, and it's really
mm,
critical that people are provided information with how to reduce these harms. But the substances themselves have, for example, very, very few physiological effects on the human body. So from purely physiological health or perspective, these are consistently ranked as some of the lowest harm
mm.
substances.
So, off the back of the recent announcement that psilocybin will be legally available in New Zealand for the first time outside of clinical trials, would you like to see, would the foundation like to see more medicinal access to the likes of, more psilocybin or psychedelics or MDMA, like we see in Australia?